welcome back to my channel, and today we are going to talk about premature ejaculation. It's a topic that not many people talk about openly. However, a lot of men are affected by this problem. And whether you are struggling with this yourself or just would like to learn a little bit more about it, we're going to break it down. I'm going to dispel some myths related to this problem, also look at the causes of this problem, and also discuss the strategies that might help. So let's dive in. Premature ejaculation is a common sexual health problem for men, and it refers to when a man ejaculates too soon during sexual activity. And normally it happens before or shortly after penetration. And quite often it happens before man or his partner really wants it to happen. So it's kind of uncontrollable action. And I would like us to look at the definition of too soon, because for some men, too soon means anything that happens within 1 minute. For some men, it means 1 minute and more. In psychosexual therapy, any length of ejaculation that happens within 1 minute plus is considered to be normal. However, the main point here is that it causes distress and frustration when man cannot control his ejaculatory process. Premature ejaculation can be caused by different factors, including psychological factors like stress, anxiety, pressure to perform, maybe problems in relationships, negative experiences. Also physiological factors like hormonal imbalances, extreme sensitivity, it could be problems with prostate, it could be negative consequences after medical, surgical intervention. But what's important to understand is that about 30% of men experience this problem or experienced this issue at certain period of their lives. Let's look at the main causes of premature ejaculation, and one of them is fear of being caught. This can come from early years of sexual experiences when a man was caught while masturbating, or maybe he feared of being caught while doing that. And it could develop neurological transmitter pathways of really fast ejaculatory process. So it's important to look at this individually and find out if this was the case, because that could be the root of the problem. Another scenario is when partner doesn't enjoy having sex due to different reasons. Maybe she's experiencing pain during sex, maybe she just doesn't like sex, maybe she's got some problems with her partner, and there are arguments and tension going on in the relationship. So man is under that pressure of finishing really fast, because he's also feeling guilt, he's feeling shame, he's feeling maybe fear that his woman is not enjoying sex. So again, quite often premature ejaculation is caused by problems in relationships, maybe lack of communication, disconnection, lack of intimacy in relationship, and quite often the other partner in this relationship experiencing their own sexual problems. That were psychological factors, but there are also physical factors like diabetes, for example, or overactive thyroid, or excessive use of alcohol and drugs, maybe lack of physical exercises, weak pelvic floor. All these things can contribute to premature ejaculation. So what can you do if you are dealing with premature ejaculation? The first thing, please do not panic and do not ignore the problem, because it will not go away itself. It's important to resolve it. And the first step to resolution is start communication with your partner. Establish trust in your relationship, establish open and honest communication where you both can relax, feel comfortable, and get rid of anxiety. The next step to treat premature ejaculation is to do start-stop method. And in my video, I'm going to talk about this method, what are the specifics, because you will find a lot of information online, but they actually miss the very important point when they describe this method. So I'm going to give you very detailed explanation on how to do this method and what's important not to miss, so this method is effective. The third step is to strengthen your pelvic floor. Pelvic floor muscles are essential in the quality of your sexual activity and, of course, your erections. There are specific muscles that affect the angle of your erections, the endurance during sexual activity, and, of course, the ejaculatory control. So in my other video that is dedicated to erection fitness, I'm going to talk about this in more detail. Another advice, go and see a psychosexual therapist. Remember, not urologist, not psychologist, not psychiatrist, not counselor, psychosexual therapist. These are the people who are specifically trained to deal with sexual function issues, especially premature ejaculation. Because the mistake a lot of men make is that they go straight to urologist who prescribes medications. Remember, if your issue is caused by psychological factors, medications will not help. Medications won't help when it comes to sexual activity unless there is an organic cause. So when you go and see medical doctor, unless this doctor has diploma in psychosexual therapy, will not be able to help you effectively. So the person who you need to speak to is psychosexual therapist or sex therapist. So if you experienced premature ejaculation once or twice in your life, do not panic and do not think about it too much, because things happen to everybody. However, if you realize that this happens on a regular basis, quite frequently, and it affects your sexual life, your experiences, your relationship, your self-esteem, then it's time to do something about it. And there is no shame in getting in touch with the professional. Remember that sexual health is very important because the quality of sexual health affects your longevity as a man. And of course, it affects your relationship, your self-esteem, and other areas of your life. So do not leave it too late until it's too late. Do something about it. And remember that every contact that you make with psychosexual therapist, it's a strictly confidential service. And in the UK, it's protected by law. So feel free to contact, ask questions, and make the right decisions. If you found this video helpful, please don't forget to hit like and subscribe for more educational and useful content as per sexual health and well-being. And please leave your questions or comments below this video. Thank you very much for watching. Remember that your sexual life matters. See you in the next video.